1919. Tabor Cyclopedic Medical Dictionary, page 561. Depression. 1. A hollow or lower region. 2. The lowering of a part, such as the mandible. 3. The decrease of vital function, such as respiration. 4. One of the several mood disorders marked by loss of interest or pleasure in living. Disorders linked to depression include dysthymia, major depressive disorders, schizoaffective disorders, bipolar disorder, seasonal affective disorders, and mood disorders caused by a substance abuse or other medical conditions. The depressive disorders are common. For example, about 1 in 5 women may suffer major depression at some point during her lifetime. The prevalence of major depression in men is about 1 in 10. Worldwide, depression is considered to be the 4th most serious illness as far as the overall burden it imposes on people's health. Depressed patients have more medical illness and higher risk of self-injury and suicide than patients without mood disorders. Symptoms. Characteristic symptoms of the depressive disorders include persistent sadness, hopelessness, or tearfulness, loss of energy or persistent fatigue, persistent feelings of guilt or self-criticism, a sense of worthlessness, irritability, an inability to concentrate, decreased interest in daily activities, changes in appetite or body weight, insomnia or excessive sleep, and recurrent thoughts of death or suicide. These symptoms cause pervasive deficits in some social function. Treatment: psychotherapies, behavior therapies, electroconvulsive shock therapies, and psychoactive drugs are effective in treatment of depressive disorders. Caution: depressed persons who express suicidal thoughts should not be left alone if hospitalized. Patient care: the patient is assessed for feelings of worthlessness or self-reproach, inappropriate guilt, concern with death, and attempt at self-injury. Level of activity and socialization are evaluated. Adequate nutrition and fluids are provided. Dietary intervention and increased physical activity are recommended to manage drug-induced constipation. Assistance with grooming and other activities of daily living may be required. A structured routine include a non-competitive activities is provided to build the patient's self-confidence and to encourage interaction. Healthcare professionals should express warmth and interest in patient and be optimistic while guarding against excessive cheerfulness. Support is gradually reduced as the patient demonstrates an increasing ability to resume self-care. Drug therapies and administered and evaluated. If electroconvulsive therapy (ECT) is required, the patient is informed that a series of treatments may be needed. Before each ECT session, the prescribed sedative is administered and a nasal or oral airway inserted. Vital signs are monitored and support is offered by talking calmly or by gentle touch. After ECT, mental status and response to therapy are evaluated. The patient may be drowsy or experience transient amnesia, but should become alert and oriented within 30 minutes. The period of this orientation lengthens after subsequent treatments. See Nursing Diagnosis Appendix. Anaphylaxis depression in infants suddenly separated from their mothers between the first months and 1 year of age. The loss of the love, affection, and nurturing usually present in the mother-child relationship may cause severe disturbances in health and in motor, language, and social development, or may occasionally lead to death. Symptoms first found in affected infants, including crying, panic behavior, and increased motor activity. Later, psychotherapeutically abandoned or neglected infants manifest dejection, apathy, staring into space, and silent crying. Recovery is possible if the actual mother or the surrogate is available to meet the infant's needs for parental support. Bipolar disorder, endogenous disorder, melancholia, postpartum disorder, depression in a new mother in which the signs and symptoms do not dissipate within several weeks following delivery, or strong feelings of dejection and anger beginning 1 to 2 months after childbirth. The symptoms are tearfulness, despondency, a feeling of hopelessness, inadequacy, inability to cope with infant care, mood swings, extreme anxiety over the infant, guilt of not loving the infant enough, irritability, fatigue, loss of normal interest, and insomnia. This depression occurs about 3% of women and may occur in other family members, including the father. See postpartum blues. Post-stroke disorder, a dysphoric mood disorder that follows a cerebral infarction, found in about a quarter of all patients who suffer a stroke. Although many years depression after strokes was thought to occur mainly in patients who had injured the non-dominant hemisphere of the brain, research has shown that this phenomenon is most common in female patients and patients who have had higher education. Reactive disorder, depression that is usually self-limiting following a serious event such as the death in the family, the loss of a job or personal financial catastrophe. The disorder is longer lasting and more marked than the normal reaction.